As an athlete, Ken Bull thought he might be sidelined by an injured ankle or knee. But he never thought it would be his heart that would put him on the bench. Then he developed atrial fibrillation, a condition where his pulmonary veins, the veins leading from his lungs to his heart, send a storm of electrical impulses to the heart, causing it to quiver. The result is an abnormal heart rhythm. Ken's story is not unusual. Heart conditions often lay dormant without any of the usual warning signs. Suddenly, the damaged heart reveals itself during exercise, walking, or simply sitting down for dinner. That's when it's time for the experts to step in.
Last night we talked to Ken and got him ready for the procedure, told him what we were going to be doing, made sure he and his family knew exactly the process. Today we'll start by putting in our catheters, trying to initiate these triggers or hot spots, and then isolate them.
The electrical impulses causing Ken's trouble are called triggers. The Penn Cardiac Care team will use ablation to actually create a barrier that will keep those impulses from coming into the heart. The procedure is complex, but will not require opening Ken's chest, so Ken will remain awake but slightly sedated through much of the procedure. Dr. Marchlinski passes a needle from the top right side of Ken's heart through the membrane into the left side. He then passes the catheter through the same path. Dr. Marchlinski begins by looking for the impulses triggering the heart to beat irregularly. He'll watch a series of monitors to see where the quivering or fibrillation starts. This sophisticated computer system allows him to track down the location of the triggers, identifying exactly where the abnormal firing is coming from.
Right now we're just creating an image of the left atrium. We're first putting our catheter in each of the veins to identify the location and the size of those veins. And so that's what we're doing in the first go-around. We have identified the two left-sided veins. Now we're going to go to the right-sided veins.
Now that he's found the triggers, Dr. Marchlinski sends energy through the catheter, placing small burns in the heart tissue to create the barrier. In a matter of moments, he'll know if it has worked.
We've been able to demonstrate very reliably that the hotspot or triggers that caused Mr. Bull's atrial fibrillation were originating from the left-sided pulmonary veins. And in the process of isolating those veins and those fibers, the atrial fibrillation stopped. That's a very good positive sign. It indicates that we've been able to isolate our target.
With the ablation complete, the fibrillation has stopped. But will it come back? And has it eliminated Ken's need for medication? We'll find out in a moment. Next, doctors attempt what was once science fiction, using this robotic system for delicate heart surgery for one of the first times. You can learn more about heart care by logging on to pennhealth.com right now. We'll be right back.